The 2014 Fine Awards for Teamwork Excellence in Healthcare. Platinum winner, VA Pittsburgh Healthcare System. Regional anesthesia and pain prevention for joint replacement, saving lives after surgery.
Over the past 15-20 years, what we've learned was that volatile agents in fentanyl not only make nausea and vomiting worse after surgery, but they act in such a way that they make pain worse after surgery too, once their effects dissipate. Our goal is to actually prevent the use of general anesthetic. A few years ago, there was a traditional recovery room scoring system that was based on a 0 to 10 scale. Our goal was to modify those existing criteria and then adjust them to the needs of modern ambulatory and regional anesthesia.
Doctors Brian Williams and Michael Kentor modified the Wake score with the addition of zero tolerance criteria. This allowed for safe bypass of the post-anesthesia care unit after most every type of ambulatory anesthetic that is designed with Wake criteria in mind, including after general and spinal regional anesthesia.
We can help lay out a landscape of anesthesia planning that is a bit unconventional.
And your pre-op score with movement? Oh, it's a 10. It's a 10 out of 10?
With the new Wake criteria in mind, the nerve block specialist RN team asks the patient, who is having a right total knee replacement, a series of questions to determine a baseline Wake score and a stop bang score for Dr. Williams.
So the first thing we asked about was your pain scores at rest and with movement and how many pain pills you're taking every day. The reason why we ask that is because we do regional anesthesia nerve blocks, and one of our goals is that the pain you have after the block wears off is equal to or less than the pain that you were living with day to day. We're doing a right total knee replacement as we talked about in the timeout a minute ago. So we're going to be doing a right femoral nerve block, a right sciatic nerve block, and a right one-sided spinal, if you will. Okay, we're going to go ahead and get started. I'm going to numb up the skin. Okay, ready? Pinch and burn right here. The regional anesthesia lets us do what we want to do, meet all of our goals, centered on you and your comfort afterwards.
You're all done. We're going to get you out of here real shortly.
Waking up as soon as possible afterwards, but still nicely sleeping through surgery. So you're sitting up okay? You're not feeling lightheaded or like you're going to faint?
No.
Okay. Do you feel like you're going to you have any nausea? You feel like you're going to throw up?
No.
Okay. Are you shivery, cold, itchy, anything like that? Okay. What's your pain score? 0 to 10. Go ahead and try to jiggle your leg a little bit. What's your pain score 0 to 10 right now on the right leg, the leg that had surgery?
I really don't have any pain. I really don't feel my leg.
The spinal, it looks like it's wearing off actually quite nicely, and the nerve blocks are taking over with the pain relief. Jen, why don't we go ahead and call for a bed? If they can take her immediately, great, and if not, we'll get the bed when it's ready. But otherwise, I don't know what did you call her Wake score?
A 10.
A 10, and all 0 tolerance criteria met?
Yep.
I agree with that. No oxygen, anything else. So
No, she's
I'd say
tolerating fluids.
10 minutes into it, I think you're good to go upstairs. The reduction in mortality here after joint replacement surgery at VA Pittsburgh has been about 75%. With respect to morbidity, we've been able to bring it down by about 33%. Once we started the nerve block program, the average pain score during the first 2-3 days after surgery was actually a 3-4, as opposed to a 6. These factors all work together to help us give them a better head start at physical therapy. Not only the pain relief, but the prevention of accumulating doses of pain relievers and their side effects, which also may slow down physical therapy.